Recently, Urban Family Practice began testing high-risk patients for COVID-19 with nasal swab tests. We're now beginning antibody testing to further slow the spread of coronavirus in Western New York. What are these tests and how do they work? The nasal swab tests are done using a swab to gather samples from a symptomatic, high-risk patient's nose and testing for traces of the virus. This test is useful for determining whether an individual currently has coronavirus. The antibody tests are a little bit different. They're done by drawing a small sample of blood from a patient and testing for antibodies created by that patient's plasma cells. These are a type of white blood cell that produces the antibodies that fight off the virus. This test shows which patients have had the virus for about a week or have had the virus in the past and may not have shown any symptoms. Why is this important? In addition to the peace of mind of knowing that someone isn't a carrier or who has already recovered and built some immunity to COVID-19, antibody testing can identify the areas where it's currently spreading and help bring awareness to those communities. Testing in locations such as Los Angeles County have already shown that COVID-19 cases have been at least 28 times higher than expected and demonstrated how contagious it is. With these tests becoming available, individuals can help protect their families and communities by receiving this antibody test. If the test is positive, they are then able to warn friends or family that they've been in recent contact with to also get tested and how to recover if potentially facing COVID-19. Before visiting our COVID-19 testing locations, please complete a screening by our teletriage nurses. You can begin this process by downloading the Urban Family Practice, GBUAHN, or GBUACO mobile apps and filling out the COVID-19 survey, or by calling our nurse advice line at 716-604-0504. Nasal swab testing is available for high-risk, symptomatic patients of Urban Family Practice, primary care providers in the GBUACO network, and now to members of the community whose providers are outside the network, in which case we will send the results to that individual's primary provider. If an individual has no primary provider, Urban Family Practice will connect that patient to one of their providers via a telehealth visit to ensure that everyone has the option to get tested. Insurance covers COVID-19 testing. If patients do not have insurance but qualify for Medicaid, they'll be connected with a GBUAHN outreach enroller who will connect them to a representative to enroll them in an insurance plan. COVID-19 is serious, and it's possible that in the upcoming weeks in Western New York, we will likely face the peak of this virus and the tolls that it will take. These tests are available for the Western New York community. Please take advantage to slow the spread of this pandemic.